Good morning, Scott and Lynn.
Good
Morning.
morning.
Hi, thank you so much for joining me today for a little chat about the work that you guys within the Care Inspectorate have done with us in Loving. I'm Liz Mitchell, and I'm the Project Development Manager of Loving, as you guys know. And I'm just wondering if you could introduce yourselves and just tell us a bit about your roles before we start chatting about the work.
Sure. Hi, everyone. I'm Scott Morrison. So I'm the Professional Accreditation Advisor within the Care Inspectorate, and part of my role is to manage the Care Inspectorate's SQE Assessment Centre. And our assessment centre delivers a course which is a Professional Development Award in Scrutiny and Improvement Practice for our inspectors within the organisation.
And my name's Lynn Williamson, and I'm a tutor assessor within that Care Inspectorate Assessment Centre that Scott spoke about. And I support the candidates who undertake that qualification and assess them on their journey through the award.
Brilliant. Thank you so much. So for anybody who's watching who doesn't actually know anything about the Loving Project and our partners, the Care Inspectorate are actually one of our partnership organisations. So we've been working really closely with the Care Inspectorate over the past 3 years of the project. Various pieces of work. We've done training and development with inspectors, and we've worked really closely with one of our partner leads, Mary Morrison. And Erin, who works within the project, she was a young inspection volunteer with the Care Inspectorate as well. So we've had really strong connections with you guys right through the project. But it was this kind of specific work that we did with you and the Professional Development Award and the candidates for that I was hoping we could have a little chat about today. So how did the opportunity to start working with Loving come about from your end?
I guess from an early stage in developing the qualification, the course itself, Lynn and I always had a vision for a co-produced, genuine and meaningful approach to working in partnership with a broad range of stakeholders in terms of the qualification. And I guess what we realised was having the vision, that's straightforward, that's the easy bit. To then kind of find how do you get that kind of foot in the door? How do you get it started? That was the bit that we were really struggling with. And I guess in reality there was an element of luck, and us recognising where opportunities existed, and that really came about through Mary Morris, as you'd mentioned earlier, joining our team and becoming a tutor assessor on the course. And through discussions with Mary and that kind of vision that we had for that kind of partnership and co-produced working, she then introduced us to the idea of Love Inc. and the work that Mary had been doing with Erin. And so it was almost quite an organic development in many ways. Don't know if you want to say a bit more about that, Lynn?
Yeah, I mean, I just totally agree. We talked about it. We talked about different approaches, who should be involved, and even internally within our organisation, it was quite difficult to identify who we wanted and how to engage. And Mary came along and brought that kind of missing link, that piece in the jigsaw that just wasn't there. And the initial working that Mary did with Erin, and Erin came along and spoke to our PD cohort, gave them feedback on her role as an inspection volunteer. The success of that and the impact of that, which we'll probably go into a wee bit later, but that was kind of the snowball effect that then made us want more, that this was the right thing to do, and how do we create more opportunities, and how do we engage much more in a co-produced way moving forward through the programme. So yeah, it was very organic and a good amount of luck, but I think because Scott and I had the vision straight off, we knew what we wanted to do. We just needed that conduit. We needed those connections and network to make that happen.
Yeah, that's what you're saying there about the connections and the relationships. That is so key. I think, for us, for Mary as a partner, she has enabled us to, like, she's opened up, you know, doors to opportunities for us that we wouldn't necessarily have been able to get to ourselves, you know. So for us to be able to talk about love and spread that message in the way that we've been able to with, you know, the scrutiny body has been incredible. So having that connection with Mary, and Mary having that connection with Erin, who, you know, has been a real key part of this whole project, as we will go into in a minute, that enabled this to happen in a really natural way, didn't it? So I think, you know, we certainly found that throughout the project, connections that we make and the connections that our young people make, and how they can continue throughout their lives makes such a fundamental difference to where they go on next in their futures, you know. So that's really lovely to hear that was an outcome of what the work that we did, because that's definitely something. So what was it that actually, you know, that we actually did together? Would you mind kind of explaining a wee bit about what the PDA is, and what the bit of work that we did with you guys in the PDA? Would that be okay?
Yeah. So the qualification has a structure and a framework to it, and there was a piece of work we wanted to do about involvement, about participation, about collaboration, and that was the part that Erin came in and it used an interview technique with Mary to sort of explore from an inspection volunteer perspective, and then there was an opportunity for questions and answers, and the participants on the qualification were then doing an activity that she was given feedback on. So the feedback that we had from that session started us thinking about how can we engage in other parts. And I think Erin had by that time moved into Love Inc. and Mary was that connection. So we started to explore sort of different opportunities. This is a golden thread. It's fundamental to scrutiny practice. It places people and the voices of people experiencing care at the forefront of expression of not just love, but that compassionate approach as well. So it's all encompassing in that element. Now, the pandemic hit just about the time when we were exploring how we could actually take this further. And that gave us a new opportunity here, because there was a number of candidates who had to pause and had to frontline face and work and support the actual role of the Care Inspectorate during that time. But there were some candidates who were able to be supported a wee bit to continue their studies to a completion. Now, those studies culminate in a project, an improvement project, where they're actually using all the learning from the qualification to actually demonstrate that they can take a leadership role with an improvement, with an outcome. So it's a project format, and our thinking was actually what we normally do at that stage is get the candidates to present to us their idea. And then as an individual tutor, I would then help and support them to hone that idea and ensure that it's actually smart and it will actually meet the requirements of the qualification. So this time around, because we were now starting to work in this virtual environment and working from home, rather than seeing it as a barrier, we saw it as an opportunity to be able to engage with yourself and Erin in a much more meaningful way, that there wasn't these barriers in terms of attending venues or finding core dates and travel time and all. So it actually broke down a lot of barriers. Because we already knew Erin and Mary had the connection with yourself, some of the relationship bits just fell into place really, really nicely. And we had some orientation meetings anyway in the lead up prior to COVID and then as COVID hit. So I think we had that opportunity to bond and build the relationship between the PDA and Love Inc. prior to actually then reintroducing what it was we were looking to do. And
Yeah.
it was, I think it was through those discussions, Scott, you can correct me if I'm wrong, but when we were planning, okay, where is the opportunity? How are we going to engage? I think that again was organic. It was like, well, here's what the candidates are presenting. What do you think? What would be the best approach? How do we approach that? And it was at that point that we were thinking about, yeah, okay, what we don't have is that experiential voice coming in there that needs to guide those candidates. That's not just about inspection. Think about it from the perspective of the person who's experiencing that. What's their emotional experience? What's their involvement and participation? What's the outcome from what you're doing that's going to impact on their emotional well-being as well as the quality of the services provided? So I think that in itself became really, really organic. So yeah, Scott, do you want to take over about then how we took it into?
Yeah, I think that the recurring theme is that organic nature, isn't it? And I think that that's really important to emphasise, that in terms of us really wanting this to be genuine partnership, then that becomes fundamental. So we were consciously trying to come into this partnership working without fixed ideas of what we were wanting from it or how that was going to be achieved. And that's what a lot of those early meetings were about, really, wasn't it? Was that sharing of ideas and how do we think this might work and what do we think that the outcome might be and what would success look like for all of us. So I think that's been really important. And then to work with the inspectors as well, because this was a new way of working for us on the course and introducing that to inspectors, that actually what you're doing, what we're asking you to do is present your project plan to a panel effectively. But actually it's a really supportive panel, that this isn't about us assessing, that this is about us really trying to support the project, and it's an improvement project, and how can we support that and maximise the value and the outcomes from that project itself. And I think that then the real strength in that was that range of different perspectives that we were getting. So we all brought something different into those meetings, and we were able to have that really generate a really positive discussion with the inspector around the project, but start to question it and offer different perspectives. Have you thought about it from this point of view? And Erin was amazing at doing that, from the perspective of young people and people with care experience, and that was so important in actually driving the focus of the project itself.
Yeah, I think from our perspective, like when we started working with you, your real passion, like you say, it was at the core of what you were doing with the PDA. You really, really wanted people with lived experience to be a part of that process and them to be meaningfully involved, not tokenistically involved, but to actually, for what they were saying and what they were sharing, to really have an impact in terms of the work that the inspectors were doing for the PDA. And I think because you were so open to the flexibility of, let's just see how it goes, let it emerge and see what we can do. And because we, like you say, we were all bringing different things to the table, it did become something real, really meaningful, and that you could see that in terms of the responses from the candidates. At the end they were like, oh, I was really nervous about it, but it was lovely. It was they were expecting it to feel a lot less nurturing maybe than it actually was, and they seemed to get something really positive from the experience of us all sharing ideas and thoughts together about how you really meaningfully include young people. So we got that sense as well. Absolutely, we knew that you guys were in the same place with us in terms of what participation should look like and how it should be meaningful, and we felt that the inspectors got something really positive from it too. So that's lovely to hear that you guys felt like that as well. I suppose we've kind of talked a little bit about what the benefits have been. Has there been any other benefits that you can think of in terms of for the inspectors or for you guys in terms of your roles?
I think there's twofold. I mean, if I take the inspectors, I mean, the feedback that we got, not just in terms of what the inspectors then produced or took cognizance of within their projects in terms of participation and the voice of people experiencing care through everything we do as a scrutiny body. There was also direct feedback on what you spoke about there, the feelings that they had about it. So they already had a connection to Erin from the input that Erin had given. They'd already recognised aspects of their role and the processes tied up in that where there were opportunities that could be explored to be done differently and maybe expanded on. But I think they got what you spoke about there. It was the passion and the honesty that what we were doing was meaningful, that this was about change. This is about listening to other perspectives, but actually taking action. So not just doing it tokenistically, like you said. And I think that was infectious for them. I think that's what they were picking up, is that this is actually being done. We're role modeling it, but equally we're all speaking the same language, we're passionate, and we're looking for that impact, we're looking for that change. So a couple of them actually, I know one of them approached you to actually come and speak to their team because they felt that your actual involvement in shaping or helping them to understand participation to shape their project slightly differently was massive, and they thought that was infectious. So they had approached you to come and speak to the team, because I think our comment was every team in the Care Inspectorate should have Love Inc come to one of their meetings. So I think there's a huge strength in that as well. So it's almost that ripple effect, that your involvement with the PDA can effectively bring about change across the organisation. But other inspectors spoke about practice changing. So it wasn't just their perspective that was changing, but they were actually writing up their public reports differently to try and actually get that perspective meaningfully from what it was like to living that service across or access that service, to get that across within their actual public reports. And a few of the other ones suggested that they hadn't quite considered all the creative avenues open to them. So Erin, for example, had given someone a good icebreaker to do in terms of an online focus group with children, and they hadn't thought of things like that. So it was even those kind of creative ideas that affected change.
Oh, that's great.
And I think what's brilliant in just sitting talking about this and listening to it as well is recognizing that we're only partway through this journey as well, and there's so much more potential in working together. And what really strikes me, what we're saying just now, is that so we've made those inroads in terms of partnership working and hearing voices. We need to then really further develop and further model that in terms of closing that loop. And how do we feed back? How do we measure what the outcomes of those are, and then feed back to the people that we've involved in that process? So
that's absolutely key, Scott. You're so right. So many young people that we talk to, they come back over and over again and go, you asked me about this, but then you've never come back to me and said what it meant or what happened. And so that has been a fundamental part of what we've been trying to do, is always coming back with closing that feedback loop every single time we do anything. And it is one of the bits that people seem to miss. And so that makes me so happy, because I know that this is what we're going through this journey together. And we're like, that's the bit that we need to now start thinking about, is getting people involved and then them knowing what their involvement has done, what the impact of that has been, so that's really exciting. And you're right, it's just the start of the journey. It really is. And I mean, we've done other things together, haven't we? We've been, we've spoken to people from all over Europe and things like that, haven't we?
Yeah, absolutely. And I guess that's almost that sort of feedback loop component of it. Sometimes you don't close the loop, sometimes you open up another loop, and that's really what happened there. That in working with yourselves, we then we started working more closely with our own working together group within the Care Inspectorate, and that led to an opportunity for us to present how we've been working with yourselves and developing that partnership working to an international audience of regulators. And Lynn and I had a discussion saying that's brilliant, but yeah, we're not doing that by ourselves. Why would we do that by ourselves? Because we need to do that in partnership with Loving. So that opened up that next loop of us having another meeting then to say, look, we've got this opportunity. What do you think about being involved? Do you think Erin could be involved? You know, and that was received really, really well by the international audience themselves, and generated a lot more interest in how the Care Inspectorate was undertaking partnership working, but also a lot more interest in Love Inc. and what you were trying to achieve in Scotland.
Yeah, they were really like, wow, that's really brave, you talking about love like that. We're like, no, it's not. It should be the way that everybody talks about love. But I think for us, that was an amazing opportunity again to be able to talk to people about what we are talking about, but in that global context. You know, we know that love is it's a humanity thing. It's a universal thing. We need to make sure that it's our entire culture and society that's thinking about, you know, our young people and loving our young people in that way. So it's so amazing for us to get the opportunities like that with you guys to go and do something on a you know, international level. But I think more than anything is what you said, Scott, about you got that opportunity and you went, well, we're going to ask Love Inc. Why would we not ask them? That's meaningful participation. You know, you didn't even think twice about it. It wasn't like, oh, I guess we better add it on and ask Love Inc. It was like, well, of course we'll ask them. We've been doing this work together. This is part of our journey, isn't it? So that, you know, that in itself is just, I think, a lovely example of work that we've done, that we do work in real genuine partnership together, and what we do is co-produced. So I think on that lovely note I will say thank you so much to you both, not just for joining me this morning and really articulating so beautifully what a lovely bit of partnership working we've been doing together, but thank you as well for just working with us over the past 2 years and giving us so many opportunities to share our message and for our voices to be heard, and to just work with the lovely team that you both are. So, and June too. So thank you. And I'll say goodbye to you now, and I'll stop recording. Thank you very much, guys.
Thank you.
Thank you.